So, Assalamualaikum. My name is Adibah. So, today I'm going to present my research proposal in a poster form. So, the title that I'm choose for my research proposal is about assessment, job satisfaction, and burnout among registered nurse in HUSM. So, we're going through with the background of the study. So, basically, the nursing profession is not the only physical demanding which deal with the function and human health, but it also involves the use of mental energy and contributes the mental exhaustion when one is continuously exposed to the stressful event. The circumstance is inevitable lead to burnout and with low quality of job satisfaction. So the problem statement on this study. So basically, the healthcare system undergoing fundamental structure changes around the world. So the comparison between Malaysia and other countries such as the United Kingdom, regardless the rapid changing in the many fields such as demographic shift, rapid urbanization, and introduction of the new technologies. So due to the rapid of changes in a healthcare setting, lead to the job as housed, and it's lead to the work demanding, and it could cause of burning and job satisfaction. So the reduction of job satisfaction could reduce the work performance in a healthcare setting. So in this study, the the research question on this study, we want to what it so the research question on this study, what is the level of knowledge of job satisfaction and burnout among registered nurse in HUSM? And there have the two hypotheses that can be contribute in this study, which is there is first hypothesis is there is no association between job satisfaction and burnout among nurses in HUSM, and there is association between job satisfaction and burnout among nurses in HUSM. So the research objective on this study, we want to identify the level of job satisfaction and burnout issue among registered nurses in HUSM, and to determine the relationship between demographic factor, job satisfaction, and burnout among registered nurse in HUSM. So the method design we using in this study. So study design and study period. I'm choosing the cross-sectional study design, and the data we collected within the 3 weeks. So this is the first rough estimate that I'm gonna do my research. The population and setting. So the population, I'm choosing the registered nurse that working at the hospital HUSM. And the sample size, I'm using the convenient sample method. And sample size, the participant will be contribute is 126. And the data analysis, I'm using the IBM SPSS statistic version 27. I'm using descriptive and Pearson correlation. So the instrument in this study, I'm using the self-administered questionnaire that adopted from Maslach and Jackson 1981, and distribution will using the Google form or a paper form. The data have a consist of three section, which is section A, including the socioeconomic graphic data. Section B, to measure the extent of burnout experienced by nurses. And section C, integrated the instrument to measure the level of job satisfaction among nurses. So next is the literature review. So the review about this study. So we understand the definition of job satisfaction. So job satisfaction is described as the degree to which employees feel good about their job and working condition, while the definition of burnout is individual stress syndrome can contextualize within complex social relationship in the workplace that consists of three dimensions, including emotional exhausted, depersonalization, and reduced personal accomplishment that develop in response to chronic exposure. So the relationship between job satisfaction and burnout very have good correlation. So the higher level of emotional exhausted, we can say as a burnout, so lead to the lowest of job satisfaction on health professionals. So the significance of the study there have meanwhile there have many studies according to this study to determine the knowledge of job satisfaction and burnout among registered nurses. However, the assessment never done toward the nurse in HSM itself. So thus this give the opportunity for healthcare provider to enhance the improvement of quality of satisfaction among nurses in HUSM. Yeah, the last so the end of this poster is reference that I'm using to find off the information. So that's all from me. So thank you.